The U.S. healthcare system can be very confusing for international students. The United States has no universal access to healthcare, and the cost of medical care is very expensive compared to other countries. For this reason, Americans and international visitors rely on health insurance to reduce their medical costs. When you go to a doctor, the provider will expect payment from you or your insurance company. UC requires that all international students enrolled at UC in F or J status carry health insurance. Enrollment in UC student health insurance is automatic at the time of registration, and the cost is included in your tuition and fee bill. You may request a waiver of the student health insurance plan, but no, foreign health insurance is not accepted. Check the Student Health Insurance website for details on the waiver requirements and process. UnitedHealthcare is the provider of student insurance plans at UC. You can print your insurance card using Catalyst. We recommend that you carry it with you at all times. You can visit the UnitedHealthcare website to search for providers. While your insurance plan will cover a majority of expenses, you should still expect to pay part of your medical care. Get familiar with the terms copay and deductible. A copay is a fixed amount that you pay your healthcare provider for services, usually at the time you visit. A deductible is an amount that you will have to pay for healthcare services before your insurance company pays. Copays and deductibles are affected by the type of healthcare you are receiving, and also by the provider you choose. For example, if you go to an in-network hospital, which means a hospital that is approved by your insurance, you will pay less for services than a hospital that is out of network. Go to the Student Health Insurance website for information about your options under the Student Health Insurance plan. So, what happens if you do get sick or injured? Try to seek the right care at the right time. For preventative general doctor visits and conditions that aren't urgent, go to University Health Services or your primary care provider. UHS is located in Lindner Center by Nippert Stadium. At UHS, you can receive primary medical care, women's health services, vaccinations, laboratory services, and x-rays. There's even a pharmacy. Generally, visits are by appointment only. The cost of most services is covered if you have the UC Student Health Insurance plan. Make an appointment and look up times and locations by visiting the UHS website or by calling their office. For urgent conditions or injuries that can be treated outside of a hospital but require prompt attention, visit an urgent care clinic or call the UHS number for an after-hours urgent physician consultation. For emergency services or potentially life-threatening emergencies, go to a hospital emergency room. Call 911 if you need to be transported quickly or you're unable to safely move. When seeking care, don't forget to keep your insurance card with you at all times and present your card to your medical provider at each visit. Remember, insurance doesn't pay for everything. Usually, if you go to a doctor somewhere other than UHS, you will be responsible for a portion of your bill. For more information and anything related to your student health insurance, visit the Student Health Insurance website.